So, starting with the first story, yes, I think this story blew up a couple of days ago. A non-vaxxer nurse, a nurse that works in a Texas hospital who does not believe in vaccinating her children and the children in the community, has just been let go from a children's hospital in Texas. Well, for two main reasons. Number one, she does not believe in vaccinating children. She's a nurse. I don't think that interrupted her work, but I think it has that's a conversation you need to have. And then number two, and most importantly, and I think this is actually the reason she was let go, there was a HIPAA violation. Let me break down the story, and then we can have a real conversation about vaccinating your children versus not, and being public about it as a healthcare provider. She's a nurse in a Texas hospital, right? And the situation goes like this. She's working in the ER. There's a child who comes in positive for measles, very sick, horrible situation. This is her first time seeing the child, and she wants to let the world know about this. And before we get into further, like I just told you, that she's a non-vaxxer. She doesn't believe in vaccinations. So she goes home after her full day of work, after seeing this horrible situation and a child who just came into the ET with measles, and she goes to her Facebook group, right? And she says in this Facebook group, and the Facebook group is actually called Proud Parents of Unvaccinated Children, Texas. And in this Facebook group, she says, and I quote, "I think it's easy for us non-vaxxers to make assumptions, but most of us have never and will never see one of these diseases. For the first time in my career, I saw measles this week. Actually, most of my coworkers and the ER docs saw measles for the first time as well. And honestly, it was rough. The kid was super sick enough to be admitted to the ICU and looked miserable." So let's break this down. Let's talk about the real issue at hand first, the HIPAA violation. So we all know, we've all told nursing stories. We've all told stories, not even just nursing, healthcare stories for all you healthcare providers out there. We've all told these kinds of stories, right? But we have to understand how HIPAA works, right? If you are putting out in public information on a patient or an experience you had at work, and that can link back to the patient that you're talking about, yes, that is indeed a HIPAA violation. So this young lady that went to her Facebook group and talked about the first patient she's ever seen that have measles, she mentioned that it was a toddler. She says that she's in Texas. So it's too easy to narrow it down. And if it is a patient that has measles, if it is a child, yes, it is super, super easy to find out who that patient is. So of course there's some repercussions. Of course that the hospital had to act, and yes, indeed, she did get fired. And that's number one, and that's clear. I'm not even going to argue about that. We all know that to be a fact. If you disagree with that, I have no interest in having a conversation with you. But let's also talk about the vaccination portion of this situation. Do you guys know healthcare providers that don't agree with getting their kids vaccinated, or don't agree with having kids vaccinated at all, period? Of course we do. There's an entire Facebook group dedicated to this specific type of nurse, or this specific type of healthcare providers, non-vaxxers. I don't know if I've mentioned this in the past, but I am 1000% pro-vaccinations. I think the science is clear. I think the evidence is clear. Not vaccinating your kid does not just leave your kid in harm's way. Non-vaccinating yourself does not just leave you in harm's way. It puts the people around you in harm's way. So that is why many public schools and many hospitals around the country let their patients and students and kids know, if you do not get vaccinated, we can't accept you to go to school. You can't accept you as a patient because you are putting everyone else at risk. These very personal decisions that you make in your own life, yes, you live in America, it's a free country, do you boo-boo, please. But the minute, the hour you start putting other people in danger, it's a problem to the world. And yes, I do not care as an adult. Once you turn 18, I don't want to get vaccinated anymore. That's your choice. Do you. Do you. But, I really hurt and ache and suffer with the situation in this story where the mothers, the Facebook group Mothers for Unvaccinated Children, mothers, parents in general who decide not to vaccinate their children. It's your choice that you don't want to get vaccinated, right? The evidence, the research is out, and it's super clear that vaccinations are important for all children, and it's super, super important for the safety of the country and human beings at large. It has saved millions, billions, if you talk about the extent of what vaccinations have done for human beings. for me, healthcare providers, moms who decide not to vaccinate their children is one thing, right? Because moms are human beings, they're people. People are everywhere. People have crazy ideas, crazy beliefs in different things. But nurses, healthcare providers that don't believe in vaccinations, that really, throws my mind for a loop. And I'd love if you guys know someone or is anyone out there that is a non-vaxxer that is willing to come on and have a conversation with me. I would love to have that conversation. And not just for you nurses, but anyone that's a healthcare provider who is a non-vaxxer. I would love to talk to them one-on-one on an Everyday Hero show that I do every single Sunday. So check those out, about why you have made that decision and how you can, in your mind, because I know in most hospitals, in every hospital job I've ever gotten, you need to get vaccinated before you become a nurse. So how can you, in clear conscience, be a healthcare provider, get vaccinated yourself while telling other people not to get vaccinated? And being in healthcare, you do need to have at least gotten the bare bones information on vaccinations and understand what they do and how they work. And if you understand that, you do get and understand that they prevent these insane diseases and infections like measles from spreading worldwide. I'd love to have a conversation with someone out there if you are a non-vaxxer.